Well, Dr. Lowry, thank you for taking the time to speak with us. And
Sure.
I want to get right to the crux of the matter. Opioids, such a big item in the news these days. Explain, what is an opioid?
Okay, an opioid opioids are a class of medication. So any medication that's derived from the opium poppy, which is a flowering plant that grows predominantly in the Middle East and countries like Thailand and Afghanistan and Pakistan. So the purest form of opium is the liquid from the plant, but there are multiple chemical derivations as well.
Okay, if it was used in antiquity, then what happened regarding the fall of the Roman Empire?
Oh boy, we can go way back. I love history, but we know that the ancient Mesopotamians used opium. They smoked it, they ingested it, and it was used in some cases recreationally as well as medicinally. And that knowledge was spread to the Assyrians, the Egyptians, and down to the Greeks. Now, the Greeks are considered the beginning of modern Western medicine. You know, Hippocrates around 400 BC wrote about the medicinal uses of opium. And the Romans had a very well-established medical system, and they used opium and for pain control medicinal purposes up until the fall of the Roman Empire around 478 AD. And I watched the movie Gladiator and saw how those guys get beat up, so I'm glad they had something for pain control.
Opioids were common in Europe. How about the United States?
Well, after the fall of the Roman Empire, we enter the Dark Ages or Middle Ages, and there's not a lot of written information about opium use in Europe, but we know that there was a lot of exchange between the Middle East and Europe during the Middle Ages. A lot of the medicine was rendered through monks and monasteries. But we know that in the early 1500s, a German scientist named Paracelsus, who was probably doing alchemy, came up with a way to mix the juice from the opium poppy with substances to make it in a substance that was a pill-like substance or a solid, which had a shelf life and enabled more widespread use of opium. And then in the 1600s, a British chemist named Sydenham mixed this substance with wine and herbs to make it more palatable, and it became very popular throughout Europe in the 1600s and spread to the New World. So by the time of the American Revolution, this substance was in common use. It was called laudanum.
Okay, and then as we started into the modern era, toward the end of the 1800s, what happened at that point?
Well, I think we have to go back really to the early 1800s. So laudanum, this pure opium substance, was in common use. It was purchased over the counter. There were no prescription medications. And then in 1803, a German scientist synthesized the first chemically derived opiate compound, and he called it morphine, after the Greek god of dreams, Morpheus. And then in 1858, the hypodermic syringe was invented. So substances could be injected at that time. And I really think the modern era of medicine began in the 1870s, 1880s. But the first big event that really we need to talk about is the American Civil War from 1861 to 1865. It's considered the first, quote, modern war because the type of warfare, the weapons used, and the transportation used was the first time that mechanical means were really used. I mean, troops were transported by railroad and things of that sort. And medicine took made some great advances during the Civil War. But many soldiers suffered horrendous wounds, and after the Civil War, there were tens of thousands of soldiers who'd had amputations and disfiguring wounds, and they were addicted to laudanum or morphine, which at this point could be given via injection. So as the latter half of the 19th century evolved in the United States, it was for the first time really recognized that opiate medicines had addiction potential.
So it sounds like the U.S. government was taking a prominent role as
Yeah.
we entered the 20th century.
Yeah, I would say by the 1890s, again, the addiction potential of opiates was very well recognized. And interestingly, a German chemist working for Bayer, the same company that makes Bayer aspirin, tried to synthesize a compound from opium that would have all of the pain-killing properties but none of the addictive properties. And in the late 1890s, he released this compound, and it was widely distributed throughout the United States. And it was quite a heroic effort to come up with a compound that had no addiction potential, so they named it heroin. Amazing. So heroin was in widespread use throughout the United States. Again, no prescription was needed. There was no regulatory body. And it quickly became apparent that heroin was very, very addictive. So the U.S. government started to pass laws. Opium import for the purpose of smoking was outlawed. The Harrison Tax Act was passed, which for the first time required that physicians and pharmacists register with the government in order to prescribe opiate-type medications. But again, another event happened which led to increasing use of opiates, World War I. So in 1914, World War I broke out in Europe. Millions and millions of soldiers were injured. Many, many civilians were injured. And opium and opiate use became even more of an issue. And again, a German chemist in 1916, during the middle of the war, sought out to form a drug derived from opium that would have all of the pain-killing properties with none of the addiction potential. And they were successful in formulating a drug. Unfortunately, it still had quite a few addiction problems. It was named oxycodone.
That's a surprise.
Yeah.
That is a huge
Yeah.
surprise. Then it leads us to the point of the war on drugs. When did
Yeah.
that begin? Some history on that.
So really, again, after World War I, thousands and thousands of American soldiers come back with opiate dependence. These medications are still widely available. So Franklin Roosevelt and his administration formed the Food and Drug Administration in the late 1930s. So for the first time, any medication that had to be approved after research by the Food and Drug Administration. But then we entered World War II. The U.S. entered World War II in 1941, and again, even there are estimates that over 50 million people were killed as a result of that war worldwide, and hundreds and hundreds of thousands of injured soldiers and civilians. So the need for pain-killing medicines only increased. We entered the 1950s, and now modern science is in full gear, formulating newer medications, formulations of opium of opiate products like Percodan and Percocet started to come onto the market. And then another pivotal event happened, the war in Vietnam. So in the 1960s, U.S. soldiers were in Southeast Asia where the opium poppy grows, and heroin use and heroin import into the United States again reared its head. And at the same time, on the home front, the Summer of Love happened. So I think Jefferson Airplane, Haight-Ashbury, Woodstock. What happened is illicit drugs went mainstream and became popular, and it came out of the woodwork. So as we entered the 1970s, there's an explosion of illicit drugs, and the federal government got involved. So Richard Nixon, by executive order, started the Drug Enforcement Agency and really launched the modern war on drugs. And that continued into the Reagan administration. In the 1980s, the term war on drugs was coined, and it really great efforts were made to stem the influx of cocaine and other substances. I remember watching Miami Vice with Don Johnson, and it really entered our American psyche that there was a war on drugs. And into the 1990s with methamphetamine and the Bloods and the Crips and all the gang wars over control of various cities for drug distribution. But something happened. We kind of lost sight of legal drugs, prescription drugs.
Yeah.
So during this whole time period, doctors were writing prescriptions for opiate medications, which were legal, and the addiction problem was still ongoing. But I think there was a perception that as long as you were taking a drug that was prescribed, it was okay.
Wow. So what got us to the point we are now? All of that just leads up to the negativity about the situation with drugs, even the war on drugs. But how do we get to where we are at this point?
I think in the 1990s and right at the turn into the current century, a couple things happened. There was a rise of patient advocacy. Back in the Ozzie and Harriet days, you went to your doctor and did what he told you to do. Okay, but appropriately so, the relationship between doctor and patient changed somewhat, where the patient would ask questions and be involved in their care. It was more of a dialogue, which I think is very good. But as an extent of that, there was a rise of lobbying groups that recognized and proposed the point that there are chronic pain conditions, that some people have ongoing pain issues, and that pain needs to be addressed, and I think appropriately so. But as a result, pharmaceutical companies started producing long-acting formulations of opiate medications. For example, morphine has a pretty short half-life, but MS Contin is the brand name of a long-acting morphine pill that you take daily, or usually twice daily, and it reaches a steady state in your system for management of chronic pain. However, those drugs can be melted down and injected, or drugs of that type can be abused in various ways. At the same time, the Joint Commission is the accrediting agency for hospitals, and it's a very powerful organization. If you walk in the front door of almost any hospital in the United States, they'll have a certificate posted by the Joint Commission, and the Joint Commission can conduct unannounced investigations or inspections of hospitals, and can remove their credentialing immediately, in which case Medicare, Medicaid payments to the hospital will stop, and the hospital will shut down, basically go out of business. So it's a very powerful organization. And in 2001, the Joint Commission, as a response to the need for increased pain control for chronic conditions, stated that pain is the fifth vital sign. Now, traditionally, we think of vital signs in medicine as the pulse, the blood pressure, the respiratory rate, and the temperature. But now, the pain control, the ability to control pain, was deemed as crucially important as knowing a patient's pulse or blood pressure. And so much so that the Joint Commission mandated that patient interviews and post-admission interviews be obtained, where they would rate the hospital's ability to control pain on a 1 to 10 scale. And the potential existed that if a hospital or if providers were not handling pain and controlling pain appropriately, that the accreditation of the hospital could be removed. As a result, hospitals, health care systems, providers became very, very aware of the need for pain control, which only increased the likelihood that they would write for opioid pain medications at a time when the availability of long-acting opiate medications was now quite available. And this started in 2001. By 2008, it's widely recognized that we had an opioid epidemic on our hands. And I think that's kind of a brief history of how we got into this complicated mess.
I'll put you on the spot just a little bit. With your knowledge, your history in treating folks that have pain, with what's happening now through the government with the oversight of it all, is that a step in the right direction in your opinion, or what would your personal opinion, what would you like to see?
Yeah, well, the STOP Act is a law that was passed in 2017 by North Carolina, and there are multiple components to it, but the big component is that providers in North Carolina can no longer write for large prescriptions of opiate medications. For example, a doctor in an office can write for no more than 5 days of pain medication. So say, for example, a patient comes in the office who maybe has broken their wrist and hasn't required surgery. Only a 5-day prescription of pain medicine can be written for. Or for surgical pain, the limit is 7 days. And I think that's definitely a step in the right direction. However, that's a small step, and we really need a multidisciplinary approach to the management of pain and the management of this problem. There's data showing that as limits have been placed on opiate prescribing and the availability of opiate medications has decreased on the street, that the incidence of methamphetamine use has increased to compensate for that. So this is a very, very complicated problem. I think the first thing is that we need to make it a transparent problem. Okay. I think the scope of this problem, the magnitude of the problem really needs to be made public. I think everybody in our country needs to be aware of this crisis. It's going to require governmental action, personal action, action from the healthcare industry, action from the pharmaceutical industry, and others to really crack this nut.
And unfortunately, it's an ongoing saga until those days are reached.
Yes, it is.
All right, Dr. Lowry, it's fascinating. I appreciate your time so much.
You are so welcome.
Thank you for the great job you do with us.
Yes, sir. Thank you.